how do you even know if a child is on the spectrum or not? So in this video, I'll tell you 7 things to look out for, to think about when going through this. And chances are you're watching this video because your child is around 2 to 2.5 years old and you haven't figured out whether your child is on the spectrum or not. And you just came back from the pediatrician, you listen to the teachers, they say there is a risk, there's a suspicion, so on and so forth. My name is Ming from agentsofspeech.com. We help parents to get their children speaking better at home through speech therapy techniques. We've helped with thousands of parents over the internet, and here we go. So the first thing is, you really don't. At 2 to 2.5 year old, this kind of age range is really hard to pinpoint whether it is autism or not. Okay. As a matter of fact, if a child is on the spectrum, usually the onset, meaning when it happens, is after 2.5. It could be 3.5 to 4. What we see and what we hear through case history as we verbally interview parents as they come into our clinics and also our online training programs, we ask, it's usually 3 to 4 when it happens, when there's a regression or they start to lose interest, as the parents would put it. It's not my words. And what you should do at this point is to clear out any other complications. The most important one is hearing. Do the hearing tests. Make sure your child doesn't have a middle ear infection, because a middle ear infection mimics a lot of the symptoms of autism. It shares a lot of symptoms of autism. So then if you know that your child cannot hear, obviously he's not going to respond to his name that readily. So we have a whole different video about that. You can check out somewhere here or in the description below. We'll link that video about hearing loss. And the second thing is, a lot of times the pediatricians will tell you to wait it out. But the problem is about waiting out is we're leaving it up to just chance. Given that you've been told about this risk that's going on, right? One of the worst things that we can do in life is, okay, I'll just wait to see if it is or is not, right? And it's really difficult to have a conversation with parents about this as well, because then they're like, oh, what can I do anyways? Because the line for therapy is really long. You can do autism screeners in the USA that go all the way back to 1 year old, 1.5. You can already do screeners. But to get a real diagnosis, it really is after 3, right? So what can you do in this situation is to educate yourself. Learn more about the whole thing, right? Just as a way to mitigate the risk, okay? And as we say a lot of times, maybe this is the first time you're here, so hi. Teaching a nonverbal child, we're talking about like a 2 to 2.5-year-old. Some people call it pre-verbal, non-speaking, whatever you like to call it. At the end of the day, the therapy goals are very similar, super similar. So you don't have to think too much. It's always going to be increasing the communication intent. And we'll always start off with what the child wants for you. So that's why a lot of therapy is like teaching, I want whatever, because child wants something from you, right? So in this situation, we get something that your child wants and we teach a communication method for your child to get it, okay? Instead of screaming, shouting, hand pulling, whatever that your child is doing right now, we want to teach different set of gestures, sounds, whatever communication means that's a little bit more appropriate, okay? So instead of waiting out, use that time to educate yourself on that. And we have a bunch of courses. Just go to agentsofspeech.com/course. Link is also in the description. We teach you a lot of that, especially in the micro course. It goes through a lot of the nitty-gritty of how to do it. It's also free. The reason is so that I don't need to make a 2-hour video on YouTube. So just check it out there, right? And then by the time you get to 3 to 4 years old, it should be pretty clear whether your child is on the spectrum or not. So whilst we're waiting for that clarity period, as I was saying, go and educate yourself. Go get more speech therapy if you can. Like, usually speaking, you cannot really get a lot of services given that there isn't a diagnosis yet and that there's a huge line outside. Okay. And then why I say that at a 3 to 4 is because there sometimes is going to be this regression. Like, it's from 2 to 3, or from birth to 3, or birth to 2.5. That little gap, that age range, right? It will seem like your child is typical developing. They're talking, they're learning words, they're playing, and then suddenly they get less and less interested in talking, communicating, and playing toys. And you don't see it in 100% of the cases, in some. So this regression happens. And I call it regression because I've recently made a video that maybe is a little bit more boring, so I'll just summarize it here. So this regression basically just means you have to remember why children on the spectrum use words. Usually is for self-entertaining purposes, right? Not really for communication. So when they lose a word, they lose the interest to the word, and because they never grasped or they never acquired the word meaning. Okay, so that's why when the regression happens, it's more like they lost an interest in something. Uh, and usually it's the sound, the word, or the activity that the word is used inside. That's why usually, and we're still guessing about the regression stuff. There are studies talking about how the wiring of a brain changes when this clicks, this regression happens. I have no idea. I'm no expert in neurodivergent studies or whatever. I'm just a person who teaches parents how to teach the children to communicate better. But this regression is also something that you need to look out for. If it is autism, usually speaking, there isn't any other disorder out there that would cause this. Okay, so if this regression does happen, then yeah, it probably is autism. So you have to be careful there. Okay, number 5, what I wanted to talk about was also interests. So children on the spectrum have very narrow interests. Okay, and this is very hard to discern because a lot of times children who are typically developing would also line up toys. They would also look at spinning wheels. But there's, from my experience at least, there's a marked difference between the interests. Can you interest a child into checking out something with you? So that's why joint attention, or the ability to care about what others are doing in a close or far away proximity, is a symptom of autism. And the reason is because if I can get a child to sell an idea, to sell a toy, to talk about something, to show something, and the child has an interest, or he actually just wants to go in and try it out, then I would say at least on the 4, I think there's 4 or 5 verticals or criterias of autism, at least on the social level or the play level, he's actually doing okay. That's what I'm thinking. And I don't really need to like go in and do more intervention about that. All right. That's how the therapist brain works. Okay. So I would look at the interests and see how can this child or your child take new ideas, toys, and interests. If it's hard and difficult and they're stubborn, it's going to be a little bit riskier. That probably is something to do with the autism, right? And then the next thing is very huge, is sensory issues, sensory needs. Children who are on the spectrum, they tend to have a lot more sensory needs. Okay. Why we're talking about this is because we call it neurodivergent, right? So the typical neurotypical brain, and we all have different sensory profiles, by the way. It's just that it's still rather within normal limits if we take everyone's averages. But then for a neurodivergent person, their sensory profiles can be totally different from us, right? So let's say that I had a child. No, I didn't have a child. I had a student who would be very sensitive to the echoes inside of the bathroom. So then we were thinking about why we couldn't get him to toilet train him, right? Why would he scream and shout and get angry? Because the more he screamed, the more echo he got, and the more annoyed he was. And he was 3 at that time. So what we did was like, okay, so what would we do? We gave him ear defenders inside of the, just mufflers inside of the toilet. It worked. So then we could finally get him to go to the toilet. And then we reduced that ear defender, like cut holes and stuff, so that more sound would go in, right? Until we faded out and didn't have anything left. And he slowly got used to it. Now, a lot of people would say, oh, these sensory issues are like, we need to cater to the sensory needs. But that's it's not a very like a helpful mentality from a therapy perspective, from a teacher's perspective. What we want to do is okay, this is how much you can endure. Can we accommodate, and then I'll train you to endure more. Because in the real world, when we're not around, your child, the person who is on the spectrum will have to cope with this themselves. So we're giving them a framework. If you can't endure such a sensory thing, and it's the same as me. Later on today, I'm going to bring some earplugs just in case, right? Because I also when it gets really loud, my eardrums shake. So it's actually awful for me. I do understand that sensory profiles are different because I am heightened in sensory of smell and also in sound and noises. To make it a pleasant experience, I have to help myself cope and endure as well. So these sensory issues, everyone has it, but then for autistic individuals, it's very hard to know how the profiles are. Okay, it could be very extreme. They could feel nothing. I had a client who felt no pain on the spectrum. Like she would drill into her skin, pinch herself, and she would feel nothing. She would hit her head, she would feel nothing. But then if you put a band-aid on her, she feels it and she hates the stickiness for some reason. So you never know. You have to really, this is the case. You see like a very extreme sensory issues and needs and profile, then yeah, I think you need to think more about, okay, this child might be really on the spectrum. And then the last thing I want to talk about is symptoms versus the cause. So remember in the beginning, I said, oh, hearing loss or just ear infections in general will actually create similar symptoms as autism. So this happens a lot of times. Autistic features, autistic symptoms, suspected autism stems from other developmental issues that share the same symptoms, right? So hearing loss is one of them. Yeah. Another one might be like sensory issues, might be another one, like non-autistic sensory issues might be another one, right? You might have other speech disorders that have the same issue, right? It could be just a good old speech and language delay. It could also share the same symptoms. It could be a cognitive disorder. That could also be a problem. It could be like a cleft palate, that something structural that's affecting how the child was listening, talking. That would also cause an issue, right? There's a lot going on. And I've seen it many times because, and I say many times because our population is skewed, because people who look for me are usually parents who are already asking for other solutions, right? So then there's this boy in Ireland, and for a very long time I thought, oh, maybe he's ADHD, probably, right? And I somehow got that right without doing the diagnosis. I don't really care to be correct, by the way. But then the pediatricians in Ireland, the teachers wanted to put him on the spectrum, and of which I thought it was really not appropriate. So then what happened was that by the time it was like 3 years in working with him over the internet, the mom finally found out there was a problem with the audiology report, and that his hearing was basically cleared, but it wasn't clear. He had hearing loss, and that's why when he first came to us, he had a speech issue. He got some of the sounds wrong, especially the high frequency sounds. Those ones he couldn't really distinguish between. And the reason was because of his hearing loss. He had a middle ear infection that has been pervasive, so to speak. It's been coming on and off, and no one knew what the heck was going on. And then when we finally cleared it, I think he still needs time to adjust and stuff. So his behavior's symptoms are still there, but it's getting better and better. So then because of his hearing loss, the symptoms that were created made people think that he was on the spectrum. So you have to separate between symptoms and the cause. So a very good analogy is if I have a headache, that's a symptom. I could have a lot of causes. It could be just a migraine. It could be coffee withdrawal that I was dealing with a few days ago. It could be something a lot more serious, like a tumor, right? That you just never know. So then when you have a symptom, don't already go to, oh, this is because of whatever, and you have to do more digging. And this is what the whole video is about. You have to dig more, right? You have to do more intervention, because a lot of times what we call dynamic assessment is we don't just put a child into a room for an extended period of time for 2 hours, and then we do a thing, and then we're like, oh, this is a child fate. We don't do that. A lot of psychologists do that because they don't have enough time, because there's a huge waiting list. But if we had all the time in the world, we'd do a lot of dynamic assessment. Dynamic meaning we're intervening, we're teaching stuff, and we're also assessing at the same time. And then to see if they can actually take the treatment. And they're like, oh, when I teach this, do they understand that? Then that's fine. If I'm introducing something of interest, right? Do they take onto it? Do they start learn the words associated with that new interest, right? So these are the good dynamic assessments that we can do. So you can do it yourself if you're a parent, because all you need to do is just teach yourself more about how to do home therapy. And you can do that at www.agentsofspeech.com/course. Okay. The link is in the description below. You can type it out on a browser. We have so many courses, but to start off with, I would always recommend you go through a micro course. That is the first course inside of all the free stuff that we have. And it just goes through all the frequently asked questions. Practically, like, some parents are like, oh, you're reading my mind. I was thinking about this question. It's because I've answered it more than like 1,000 times already. So that's why I made it into a course, so that you can digest it and learn it, and then ask better questions inside of our community, which is included in the courses. We have 14,000 parents online in that community. Most of them are veteran parents who have gone through a bunch of therapy, have taught themselves something, and if you ask a question, they'll answer you. Okay, so that's all for this video. If you're interested, click onto this video and learn more.